You know, it's such an important day, important month. I'm glad that a month is set apart to address this.
It's such an important day,
Yeah,
important
that
month.
month.
I'm glad that a month.
Welcome, everyone. Welcome to Medical Mondays with Dr. O, where we believe strong health leads to strong future, where we come every week to talk about some health issue, especially in prevention, to help us prevent disease entity and to live better, healthy lives. Welcome again. I'm Dr. Tony Okwesomi, popularly known as Dr. O, and I host Medical Mondays with Dr. O. Tonight, we have Dr. David Ajibade, who is going to talk to us about reversing cognitive decline. That's, forgetfulness, dementia, we can go on like that. I deeply thank Dr. Ajibade for giving us his time and giving us the grace to come back, because a few weeks ago, he talked to us about prevention of this same issue. This month, the month of June, has been earmarked as Alzheimer's and Brain Awareness Month. And so we felt it's a great way to start the month to actually address cognitive issues. So without much ado, I'll yield the floor to Dr. Ajibade, who is actually a Medical Mondays with Dr. O family. So welcome. The floor is yours.
All right. Thank you, Ma. Thank you, Dr. O. I appreciate your bringing me back, and good evening, everyone. Dr. O, thank you so much for all you do for our community and beyond. This is it's great to have a community where people can have their questions answered and they can discuss into greater detail, especially when it comes to things that concern the Black community. Because what I've seen, I'm sorry, there's an echo here. Are you hearing an echo, Dr. O?
No, there's no echo. You're very clear.
Okay, good. All right. So what I've seen is that many times, even the way we're trained in Africa, we're trained primarily from the white person's perspective, and we tend to think in that direction, even though we're treating Black people. And so, having worked in the two worlds, I've seen that we have to point out more and more the things that make Black people different biologically from white people, so that Black people will not make the same mistakes that white people do, or will be able to account for some of the weaknesses, shall we say, I hate to use that word, but weaknesses that we have compared to white people, but also take advantage of the strengths that we have compared to white people. Today is not about that. Today is really about cognitive decline. But the truth of the matter is it affects Black people more than white people for certain reasons that we may have talked about before. So I'm going to, I hope everybody can see my screen. Just a quick recap. I live in two worlds. I run a foundation and a clinic in Nigeria. We started, a lot of the insights that I have today, they came from treating very, very severely I don't use the word damage, but kids with severe brain disorders, either from birth, before birth, or after birth. And they had nowhere else to go. Many of them were from very poor neighborhoods. So we had to learn how to treat kids in a very, very poverty-stricken environment. All they had were just the ability to enter a bus and pay transportation fare. They could not pay for treatments. They certainly could not pay for tests. So it was in that environment that we had to learn how to help them. And we learned a lot over the past 10 years now. In fact, it's going on 11 years. We have an outreach in 2 weeks' time now. But we learned a huge amount. In fact, I'm thinking that maybe we should be paying them now because of the things that we have learned. The most important thing we learned was that if we found the right nutrients, the building blocks for the brain, And if we gave them in the right sequence, in the right order, and in the right doses, that to a very large extent, we could significantly help these children for whatever kind of brain disorder it was. The key was finding the right nutrients in the right amounts. This also applies to adults as well. And in fact, we had never planned on treating adults with brain disorders, certainly not with dementia, because we were trained that once a person has dementia or Alzheimer's disease, that is it. It's the one disease that cannot be prevented, it cannot be slowed down, it certainly cannot be treated or cured. It was this big bad wolf that's going to huff and pop and blow your house down, no matter what you do. There was nothing you could do. And that's how we were trained. And that's what I always believed. It was only as a result of having treated thousands of kids with brain disorders that we now said, okay, let's give it a try, because we started having adults coming to us with these problems. And so, like dementia. So we said, okay, since we have seen some things that were impossible to treat in children, maybe we can also see if we can, to some degree, address this big problem of dementia in adults. And we started looking, and lo and behold, we started finding people and experts, many of them in this country, who are beginning to find solutions in certain areas of dementia. So I would fly back and forth twice a year, sometimes 3 times a year, from Nigeria to the US to sit at the feet of these people and learn from them. And they were gracious enough to give me a lot of information. One of them is the person on my right to your left. That's Dr. William. He's not even a medical doctor. He's like a chemical engineer or something. He had kids with autism. He tried to figure out what to do about it. And so he found solutions, and he created an institute, William Walsh, the Walsh Institute. And they're based in Chicago. He's close to 90 now, but he's teaching doctors all over the world. And I flew in for one of his conferences. The conference cost $2,500. I called from Nigeria. I said, we're from a poor country, which is probably a lie. But I said, please, can you give us a discount? We told him what we were doing. And he and his team graciously gave it to us for $250. Not only that, but they covered our entire weekend, hotel, food, and board. And I've seen this kind of support happen over and over again. That's why I'm so grateful to this country for a lot of the things that we have learned. As a result of the things we've learned and we've done, we've received several awards. I'm not going to hang there for long. But so I just put that as a background. I like to speak about 4 cardinal principles when it comes to the brain. Dementia, number 1, dementia is preventable. Yes, dementia is reversible, and we'll come into that, I promise. I know some of you are very skeptical about that. Number 3, if it's going to happen, really, you're going to have to play an active role in it. Therefore, your brain is in your hands. And number 4, which is the big one, everything around you, including your medical, your healthcare practitioners, everybody who has not been fortunate enough to have the kind of education that I have had, will say that everything I've just said is a lie. Or these 3 things above is a lie, or it is not true. But hopefully things are beginning to change. I have to say this, that one of the things I came to this country 5 years ago in the middle of the pandemic. One of the things that somebody told me that I was in complete shock is that memory loss, people who have memory loss is a big problem. Many people do not know what to do about it. And that there is no medication. There is nothing a neurologist or psychiatrist can give to a patient who comes to the doctor and says, "Doctor, help me, I think I'm losing my memory." There's no single treatment for it. Usually they'll say, well, try to sleep better, try to exercise more, try to eat better, and don't worry too much, right? And come back next year. If it's still the same thing and nothing has progressed, they'll say come back the next year. Now, for some people, it may eventually progress to full-blown dementia. That's when they can treat. But memory loss on its own is something that there's no treatment for it. And that's to my utter shock, because that's to me, one of the simplest things to do. As a matter of fact, my mother, she's had a tough time in the past, and she has a heart condition that she's dealing with. She may have had a few minor strokes in the past. So my dad started complaining that she would not remember what they talked about in the morning or 2 days ago, or a week ago. And my dad was always complaining about it. So I checked in with her. I got a few things here, shipped it to her in Nigeria. And I think I don't know how long later, I was talking to her about it. I said, okay, how's that memory issue? She didn't notice it. It was my dad who was noticing it. So she said, well, he has stopped complaining. And so I thought, okay, let me ask him. And I asked him, and he thought for a long time. And he says he has not noticed it at all. And trust me, my dad will complain. He will let you know if he's not happy. And he did not notice it. And my mom now says that sometimes she forgets things, but if she thinks about it hard, it comes back to her, to her surprise. That, according to, it seems like most doctors cannot do that, or they don't have a treatment for that here. Again, to my complete and utter shock. So the question is it possible to reverse cognitive decline? Well, I'm going to first of all say that that's almost a ridiculous question, because since dementia is the most severe form of cognitive decline, because it's not just about cognition, dementia affects memory, it affects mood, it affects behavior, it affects the whole brain for the most part. There are certain kinds of dementia that are actually called reversible dementias. Yes, there are irreversible dementias, but there are a lot of dementias that are specifically designated as reversible. So yes, the answer straight off the bat is that yes, you can reverse dementia. Now, if you're asking, is it possible to reverse irreversible dementia or irreversible cognitive decline? Well, that's a different question entirely, and we're going to get into it. Just before I proceed, I know Dr. O covers this aspect, but who knows where this video is going to go. Bottom line is that please check with your medical provider before you change any treatments, before you decide to take any medication or supplements, yada, 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 yo, you got to do that, okay? In my opinion, you should be on supplements. Everybody, absolutely everybody should be on supplements, especially vitamin D. But like I said, check with your medical provider first. All right, so as I said, there are two types. There are the reversible and irreversible dementias. There are about 100 types of dementia. People don't realize that, 100. So here are some of the common causes of, shall we say, reversible dementia. And a lot of them have to do with nutrition. Some of them have to do with medications, even the so-called over-the-counter medications that are supposed to be safe, especially in seniors. Some may not be safe, especially if you use them over a long period. If you see number 8 there, it says infections. COVID-19 would be a perfect example. A lot of reports from my colleagues who are neurologists have reported that there has been an increase, a spike in dementia, especially in those who had COVID-19 plus loss of smell. I may have explained in the last talk that the smell center or the olfactory center in the brain is closely connected with the memory center and has a disproportionate effect on the memory centers of the brain if it is damaged. As a matter of fact, the olfactory center or the smell center in the brain is one of the few places where new brain cells are generated. And so if there's damage there, you can imagine how that can affect brain health as a whole. Excuse me. I have highlighted here in green normal pressure hydrocephalus. That's a situation in the brain in which there's some kind of blockage. We all know there's like CSF, there's a clear fluid that basically surrounds and cushions the brain. It's between the brain and the skull, and also within certain parts, certain chambers of the brain. So it's like a fluid, like water, that helps as a buffer. Sometimes, and that fluid is constantly circulating around the brain and getting out and coming back in and being replaced. Sometimes, in certain situations, that there's a blockage of the outflow, and so the fluid begins to build, and that in itself can cause dementia. The solution is very simple. The neurosurgeon can just place a shunt in the brain to relieve that flow. That's it. Now, if the doctor does not know this, or if the tests are not done to identify this problem, that person will have dementia, and you will think it's Alzheimer's disease, because it's very much like Alzheimer's disease, and it includes some degree of imbalance and a few other things. But but many people have actually died with dementia because it was not identified. So bottom line is, what I'm trying to say here is that there are certain dementias that can easily be reversed once you know what the underlying cause is. These are the common, I think I know what I saw last time, these are common causes. The commonest dementias are seen. The top 5 or 6 are the dementias that would be termed irreversible. Some of them are called, but the others, like I've already talked about number 8. The number 9 has to do with alcohol excess, but it's also related to vitamin B1 deficiency. Simple vitamin B1 deficiency, they are now beginning to find out, can be a cause of dementia, and vitamin B12 too, by the way. The number 10 is a HIV, so that's an infection. So if you treat the HIV properly, the dementia can go away. Number 2, I want to point out here is called vascular dementia. It's a kind of dementia that is as a result of problems with the blood flow or diseased arteries. So the arteries maybe are inflamed, they're not responding like they should, so they're not supplying blood to the parts of the brain that needs the nutrients, the oxygen, whatever. It is more common among African Americans because cardiovascular disease is more common among African Americans. What they found out is that if you can address the vascular disease, you can, to some degree, improve the dementia and the health of the brain. So people are beginning to say, well, listen, let's not just accept that this person has dementia and then everything else is just social support, caregiver support, getting help, getting professional care, and just basically chaperoning the person to their grave, because that can be very expensive, can be a huge burden, as many of you can imagine. Let's find out if there are things that can be done. By the way, let me see if we have, yes, by the way, what we refer to as Alzheimer's disease or Alzheimer's dementia, they are now beginning to find out that there are very few cases in which it is pure Alzheimer's disease. I'm just going to go back to this slide. Many times they are finding out that these are actually mixed, what they call mixed dementias, that there's some degree of Alzheimer's, which means the person has the plaques, the amyloid plaques and tau tangles, but also some degree of vascular involvement, and maybe a few other things that are mixed in there. So, like I said, if there's something you can do about the vascular aspect, maybe not the Alzheimer's disease or the plaques and tangles, but if you can do something about the vascular aspect, you can, to a certain degree, reverse what's going on. But I see the problem is that, especially with medicine, I see this in medicine, I see this in religion, and I see this in education. Once you've established dogma, it is extremely hard. I mean, it would have to be an act of God to change. And so it seems to me like everybody's, or at least the powers that be, are fixated on saying it's Alzheimer's disease, we have to find a drug. That the only way we can treat this disease is that we have to find a drug that will remove the amyloid plaques. And hopefully, when the plaques are removed, we shall have restoration. well, guess what? They've developed drug after drug after drug that has, in some cases, removed the plaques, but the cognitive decline is still there. I just have this sort of picture here saying that all the different kinds of dementia. So I guess the main thing that separates a reversible dementia from an irreversible dementia is right up here. The irreversible dementias are as a result of neurodegeneration. So over time, there are certain parts of the brain that have degenerated, almost like a building rusting away. So those are the terms, the ones that would refer to as irreversible, and you have them here in front of you. About 5 of them. As I said, there are about over 100 different types of dementia. So this is, yes, these degenerative dementias have to do, they are a larger percentage or proportion, but there are a lot of other causes, and I keep insisting on it, that if we find that we should not just passively accept that this person has dementia and there's nothing we can do about it. There might be other things that can be done to improve their health. And obviously, my perspective is there's a lot of nutrients that can be applied to every situation. It doesn't matter what it is. There's a nutrient deficiency there somewhere. And I believe that we should start there. Most times, nothing about the nutrition is nothing. They don't even think about it. And I feel that's a big mistake. Here's another picture that basically everything is on the left. What you want to focus on. It's the most Alzheimer's disease is the most common type. Then there's frontotemporal. We're not going to explain all of these. You might want to check them out later. Maybe ChatGPT can help you out. So, like I said, the main way commonly Alzheimer's disease is affected, is treated, is what they use anti-amyloid chemicals, anti-amyloid drugs to remove the amyloid plaques. It says at the bottom here, the benefits are modest. I would say they are less than modest. Another thing they can try, everybody has heard about donepezil. What's that drug again? That it's anyway. The most common drug is I probably need some medication myself. But anyway, symptomatic. Some of the drugs, the drug that has been most successful in treating dementia is the old one that they've been using for years now. And basically, what it does is it tries to increase the level of a certain neurotransmitter that has to do with memory. It's called acetylcholine, and so the drug is trying to increase the levels. For some people, it works, but only for a few months. Afterwards, the person, the brain becomes resistant to it, and it continues to decline. They also treat depression, anxiety, agitation. So those are the other things that the traditional medical approach does, because usually the main thing they use to treat usually doesn't work. So they try to treat the symptoms. They try to address anxiety, aggression, and so other things. And so it's hard on the patient because they just keep on using drugs on them, and the loved ones see their brains declining. So our approach, now that we've talked about the standard approach, which is failing, I hate to say, I wish I could give you better news than that, but it is. And until they change their approach, they will continue to fail. And that's not good news, because the rest of the world, there are huge numbers, especially in third world, or shall we say developing countries, that are coming online. The populations are aging, and the older you get, the more likely you're going to have dementia. And so if this is the approach that we're using, we're in trouble. We're in serious trouble. We need to do a pivot and embrace other modalities rather than just saying, no, we have to remove the plaques. We have to remove the plaques. It's like they're beating the same drum over and over and over again. All right, so what's really going on? To really understand how to treat or how to see improvements in dementia, we have to understand what's really going on. This is a busy picture It's a very busy picture, but I'm hoping that I can just highlight a few things. And some of the things I talked about, excuse me. I played a lot of pickleball today, so I'm getting really thirsty. Excuse me just a minute. I shouldn't be drinking from a plastic bottle. I'm setting a bad example. I apologize. Okay. Number one here is brain energy depletion. If you remember, okay, I'll get to it in a minute. The point I'm trying to show in this is that there are a lot of things that are involved when in the brain of a person that has dementia. There are about 10 things, and the 10th one shows basically that the brain of a person with dementia is about 30% smaller. It has shrunk by about 30%. That is a lot of brain power. It doesn't get restored simply by taking away the proteins. You need a major overhaul, a major intervention. And that's what I'm talking about here. So you see the smaller brain on the right. So how do we address this? Obviously, we have to address it from several different aspects. And our approach is called the Building Strength approach. The Ministry of Health in Nigeria has approved it as a way of treating brain problems in children and adults. And so when we apply to dementia, here's the best definition of Alzheimer's disease that I've seen. And this is from the Alzheimer's Association. It is a degenerative brain disease that is caused by complex brain changes following cell damage. It leads to dementia symptoms that gradually worsen over time. The key here is highlighted, cell damage. And as we discussed, maybe in a few weeks ago when I spoke last time, we discussed that that the things that cause cell damage can eventually cause energy depletion. And I mentioned how that is so key to everything. And eventually there's complex brain changes. And then the brain just basically starts to shrink. The brain shuts itself down. So this is the key. If we are going to treat brain dementia, Alzheimer's disease, whatever, if we are going to successfully treat these conditions, then we must take into account some of these causes and address them as well as anything else that we're doing. And one of the things that we pointed out is that there is a significant drop in energy production, let's put it by the brain. The brain is not able to take in glucose and produce energy in the form of ATP like it should. I have this graph here basically showing even in adults, as the older you get, the less energy your brain has. Now, when you add on top of that, effect of things like menopause, the effect of things like drugs, medications, the effect of things like injury and so on, that energy level further drops further down. So that has to be addressed as well. In addition, I'm just kind of giving you the overview now, and then I will tell you how we address certain things. I have this picture here to show you that when the brain is affected, you cannot just, it's part of the reason why the brain is failing, let me put it that way. Part of the reason why the brain fails and gets dementia is because the systems, the other systems that are supposed to support the brain, like the endocrine system, the nervous system, the cardiovascular system, as we mentioned earlier, these other systems to some degree have failed as well. So simply addressing the brain and just isolating the brain and isolating a specific protein in the brain, there's no way it's going to work, because you also have to address the systems that have failed. So our approach also focuses on supporting the other systems as well. So it's not just the brain that we focus on. Just want to quickly skip back to the damage. If you remember in our last talk, we talked about dementia's dirty dozen. They all start with the letter I so people can remember them. And they're everything from illnesses to injuries to insults to inactivity. And I explain all these things. As a matter of fact, because I found out I was explaining this all the time, I put all of this together in a very colorful book, in a colorful book, I think. Well, it's not really colorful. But anyway, we explained each in each chapter, and I created an ebook. This ebook, I can put it in the chat boxes at the end of the talk, so you can purchase this. There's a link to purchase the book. This will also help with our work in Nigeria, treating kids with brain disorders. We have, like I said, on the 19th of June, we have a major outreach on the World Sickle Cell Day. So we will let you have access to it. If you want to get a book for yourself, the link will be in the case notes, and that's the cover of the book with the 12 reasons. And if you can see in the center here, you see the brain is shrinking. These are all the 12 pathways that lead to dementia. Okay, so this is a picture of really what we have to address. At the top there is energy. In my opinion, if you can address energy levels, you would not have dementia. Because what we now know is that once the energy levels drop, once the brain is not able to produce enough energy, that's above a certain amount, 40 to 50%. Once it drops, its energy production drops below 40%, you will have dementia, because the brain will now start shutting itself down. It will now start pulling back. To start pruning all those synapses. It has about 100,000 synapses. It will start pruning. If you can restore that energy, and that was a missing piece for many years. I would treat and I would get failure. In some cases, I'll get a success. In some cases, I'll get failure. But once I learned about the energy levels, about how to help the brain generate more energy, it solved the problem. And we're getting results just like that. We also have to address blood flow, like I keep on saying. I attended a meeting one day, and I saw this was a panel of neuropathologists, people who studied the dead brains. And one of them stood up and said he has seen at postmortem brains that had a lot of amyloid plaques, but they did not see, but before the person died, there were no complaints of dementia or cognitive deficits. They had also seen a lot of tau tangles in other brains, which is the tau tangles, another form of protein that they see in people with dementia. But there was no sign before death of cognitive decline in that sense. But then he said he has never seen a brain that had tau tangles or amyloid plaques plus cardiovascular disease or vascular disease, diseased arteries or diseased blood vessels in the brain that did not have dementia. In other words, what he's saying is that is really the inflamed arteries, the blood vessel disease that is the key thing in this whole problem of dementia. I think it's more than that. I think there's also like I said, the energy aspect and maybe a few other things. But I thought it was very telling that somebody who actually studies the dead brains of people with dementia can come out and say that. So it was basically challenging the prevailing dogma that everybody has come to accept, that is the amyloid plaques is the amyloid plaques, therefore fix the amyloid plaques. He said that is not so, and he's the expert. All right. So another thing we want to address is brain support. And by brain support, I'm talking about specific things like sleep, overall brain nutrition. One of the things that I've seen is potassium. Potassium is one of those things that are extremely important for brain brain function. Magnesium as well, zinc as well, that are almost universally lacking, especially in seniors. And especially in Black people as well. And unfortunately, there's a lot of fear about potassium. I know Dr. O and I have arguments about it all the time. But we're getting in our diets or supplements, we're getting far below the recommended dietary amounts of things like potassium and magnesium, far below. And so if you keep on, it's kind of like with a car, if you keep on driving you're always waiting until the engine lights or the gas meter is like screaming at you that it's almost empty, and then you now fill it up to 1/4, and then you now wait again until the lights are springing. Yeah, if you're constantly driving a car with the petrol levels, I mean, don't look at me funny. I know you've done it too. I've done it. You're constant when there wasn't enough money. You're constantly driving around with the petrol at low. It will eventually affect the engine. Same thing with the brain. We're constantly walking around with very low nutrient levels. The brain is going to make the most of what it has, but it's not ideal. And over time, especially as you grow older, it becomes less effective at using the little nutrients that you give it. And so that's why sometimes it fails. Hormonal supports, everything, we have nutrients and nutraceuticals that help the brain and body make the estrogen, testosterone, and progesterone, and even thyroid hormones that it needs. These 4 hormones are the most important hormones that the brain needs for survival, especially estrogen. And that's one of the reasons why women have it worse than men do, because at menopause, there's a sharp decline in estrogen levels. Now, if women had access to an OBGYN who knew what they're doing, but only 1 in 5 are trained in this, if they had access to that kind of person, that person will now look at their hormones, test their hormones, and then give them the right amounts for them, and so that they would have significant improvements. But that is very few women that actually get that kind of care. Most women simply have to just soldier on and just survive through it all. And many times they just suffer through it all. So again, we do it without testing, because we use nutrients and all that. And if the person feels better, then we know we're on the right track. If not, we change. But they're really safe things. Another thing, we support the immune system, because the immune system and the brain actually work hand in hand. For gut support, obviously, that's the important thing. 2 reasons why gut support is important. One is that if you eat your food, the only way that is the nutrients can be broken down into the right building blocks that can help the brain, is if it goes through the digestive system. So the digestive system is crucial to break your meat, your eggs, your chicken, your cauliflower, whatever, and extract the nutrients that the brain needs. So if the digestive system is not working properly, then it is not going to produce the nutrients that your brain needs. So we have to support the digestive system. The other thing is that the microbes, the probiotics, the good bacteria in the gut have a huge influence on brain function, not just brain function, brain development, brain protection. So if those microbes, if those good bacteria are not supported, or if you are constantly eating bad foods that damages the good bacteria, well, it's going to affect the brain as well. The third thing is the lining of the gut. There's something called leaky gut, which means that there's a barrier that keeps the bad things are in the digestive tract, the toxins and all those other things that you eat along with your food. There's a barrier that keeps that from getting into the bloodstream. Sometimes, as a result of bad foods, emotional stress, and so on, that barrier can break down and allow these toxic things to get into the bloodstream and eventually get and affect the brain. So gut support is crucial, absolutely crucial. A quick anecdote. I remember I was hosting a webinar many years ago. One lady said that she took her father to have a colonic, which is they just flush out the colon. Her father had severe dementia, could not speak, could not do anything. I don't know why they took him for the colonic, but apparently after he had the colonic, for about 2 weeks, they said he was lucid and clear, as if he didn't have dementia. Then after that 2 weeks, he regressed and the dementia returns. But for 2 weeks, he was lucid and clear. So that tells you something, that there's something in the guts that plays a role in dementia. It plays a role. Let's put it this way. That plays a role in brain health. And then the final one is detoxification. There are some, and toxins are one of my dirty dozen. And there are some. In fact, China is one of the top. I think China is number one when it comes to dementia in the world. And the major cities in China have severe environmental pollution, and they are connecting that to the high rates of dementia there. Interestingly enough, Baltimore here is the asthma capital of the country. This is the asthma capital of the country. When I heard that, I think I heard that a few months ago. Well, I'm like, well, it makes sense because asthma is related to toxins in the environment, and Baltimore is an old industrial town, so there's been a lot of industrial waste that has kind of settled here over the years, over the decades. So if asthma is high, it means that there's a lot of toxins, and if there are a lot of toxins, I guarantee you, that's one of the reasons why Baltimore City is number one for dementia in the country. It has to be one of the reasons, because environmental toxins play a huge role. And by the way, with ladies too, ladies, I'm not blaming you for anything, but you all put in, say, about 12 different chemicals. So there are all kinds of things that may have toxins, everything from hair dye to hair straighteners to certain kinds of fragrances and all that. I don't want to get in trouble, but anyway, that may be a factor too, why women have it worse than men. You got to watch the toxins that you put in and on your body. All right, a few success stories. How much time do I have? We're going to wrap it up very soon. So a couple of success stories. Dr. O.
Go ahead. You're good. You're good.
Okay.
Don't rush. Thank you.
Okay, Ma. Thank you very much. So Dr. O knows some of the success stories we've had. These are patients that I haven't seen. Many of them I haven't even seen before. Basically, a loved one would reach out. Maybe they see us on TV. We have a TV show in Nigeria, and then they would say, "Oh, can you help?" And so we kind of like we do a workup, find out what's going on. Maybe in our discussion, we find out where the problem was or how the problem started, and then we ship over to them a whole bunch of different supplements and nutraceuticals, and then I basically hold them by the hand and show them how to gradually administer these nutrients. But then I also wait for the feedback. So based on the feedback, I will now adjust it. So it's a very intense process. Everything's for the most part is on WhatsApp. So, okay, what happened yesterday? Okay, she slept better, or she had more anxiety. Okay, let's increase something like melatonin or something. I mean, just give me examples. So that's how I work with these patients. I mean, I'm not there. And they have access to me 24/7 and all that. So it's very intense for me. One example, this man, through a mutual friend, his mom, he reached out to me. His mom, pretty much bedbound. She couldn't walk. She couldn't even eat by herself, so they had to feed her. Obviously, she had a Pampers, so she had to. She couldn't take care of herself in the restroom. So I sent all this to her, to them, show them how to use it, worked with them, like I said. I think to me, it was shocking too, because it was certainly less than 2 weeks. Then 2 weeks, she was remembering who her grandkids were. So they sent me a video of her pointing to each child and saying, "You're this, you're that," and then the house help or the maid, you could see her dancing in the background. So she was like so thrilled that the mother was now remembering. Then later on, they now showed her walking with support outdoors, and then they were throwing the pillow back and forth from her. So she had to learn how to catch the thing. But the one that shocked me the most was the son sent me a video of her at night. So they have the bed cam, the camera that's on her. He sent me a video of her at night, waking up in the middle of the night and heading to the restroom by herself, and then coming back. And he was so thrilled. I mean, so what that tells you is this: not only did the strength return and the balance return, so she could navigate her way to the restroom. But also the fact that she couldn't, before she would just poo in her or urinate in her pampers and she would sleep like that. But it showed that she now had the awareness and the presence of mind to say that this is not going to be comfortable for me, so I have to take care of this. This is from somebody, like I said, who was almost completely bedbound and who had to be fed. Now she's feeding herself, and now she's going to the restroom by herself. So I thought that was very interesting. There was another one that I showed Dr. O. They saw me on TV, they reached out, and then I kind of helped her. And then I think part of the problem was this woman was I think she was 85 or 86. She would go to the restroom, and then she would, instead of using the toilet paper, she would use the towel. And then she would not, she would just mess the place up. And once she started using, and then she wouldn't, obviously, the other things, she wouldn't remember who was who and all that. Less than 2 weeks. I mean, usually, and then here's the thing. If your brain is given what it needs, it doesn't take long to fix itself. Now, I'm not saying 100%, but if you give it in the right amounts and the right doses, it will, to some degree, begin to correct itself. And so, I mean, so my standard is this: if I'm not seeing results within 2 weeks, there's something I'm doing wrong. Either I have to increase the dose or try something else. We learn that from children too. With children, it's even faster because their brains and their bodies are working so much better. So we see them within days, they're getting better. Anyway, so this lady, like I said, within a week or so, she was already, she stopped doing all that thing she was doing in the restroom. She started remembering who was who, and she actually was there with her daughter. They were holding the pills that we gave them, and so grateful. And finally, the daughter said, "Mom, what do you want to say to doctor?" And she said, "Doctor, thank you so much." Da 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 da. This was somebody who could not really put two sentences together. Then I think the final one is trying to remember this one now. Anyway, it'll probably come back to me. Yes, this one is an interesting one. This man was in the UK. Very bad dementia as well. That's the problem with us, folks. It's only when things are very, very, very bad. That's when they reach out. Same thing with autism. I treat kids with autism as well. It's like it's usually the father that is at fault. The mother will say, "There's something wrong with this child. There's something wrong with this child." The father said, "Just never mind. That's how I was too when I was a child. Now I turned out okay." And then that's how they drag the child. Now, when the child is 6 or 7 years old, they should have come when the child was 5, 6 or 7 years old. Then that's when they come, and it's a lot harder. I guarantee you, it's a lot harder to fix the child at 6 or 7 as opposed to when the child is 3 years old. Anyway, same thing. They reached out to me, I think through a mutual friend. I got the things, like I said, I shipped them to the UK. It was very expensive. To just the shipment, almost $500, we shipped them to the UK. Showed them how to use it. Now, one of the things that the woman, the wife of the man who has dementia, one of the things she complained about was that the man would be sitting in the living room, the white nurse, caregiver would come in, he would speak Yoruba to her. The wife would come into the front door and he would speak English to her. So you can see the wires are crossing there somewhere. And then when he's watching TV, like his favorite drama, he'll be reacting to the TV as if they're talking to him. So he starts shouting at them, abusing them, cussing them out because he thinks that they are attacking him. So that was pretty standard. Anyway, so after they had used the supplements for a while, I'm talking about within a week. This one for sure was within a week. She said that within a week, she would come in, he would speak Yoruba to her. The white nurse would come in, he would speak English to her, and he would just keep quiet and watch the TV. Laugh when he's supposed to laugh, frown when he's supposed to frown. But he was not arguing with the characters in the TV anymore. So I thought that was very, very interesting. Because one of the things with dementia is that those connections, and about 100 trillion of them, those connections, they don't work like they should. So you see somebody now wearing his shirt inside out or buttoning the wrong buttons and has no clue, or they're missing their way. They can't find their toilet in the house that they've lived in for 40 years, or they can't find their way home after church. The wires are crossing. But once you help provide the nutrients and the building blocks to help their brain put the wires in the right place, you can, to a certain degree, resolve these things. All right, so I think I've spoken a lot. Let's wrap this up, shall we? We've said a lot of things. Okay, so Dr. Ezegusa mentioned some things about prevention again. Dementia can be prevented. One of the things, obviously, is dementia's dirty dozen. Understanding which of these issues most pertain to you. I would encourage you, if you can, to get the book, because that helps to really lay everything out. But I also say, because I deal with nutritional supplements, I have what I call the non-negotiables that every person should be given their brain. These are basic nutrients. So there are 7 altogether. 4 vitamins, 3 minerals. The vitamins are vitamin B complex, especially the ones that are most important: B1, B12, then B2, and which is riboflavin. That's also becoming very, very important. But to get a very good vitamin B complex will be a good start. Vitamin C, it can never go out of fashion. It is very important to protect the brain. Vitamin D3, we blacks are very deficient in it for the most part. And vitamin D3, at least 40% reduces your risk of dementia by at least 40%, according to the Alzheimer's disease study. And then vitamin K2, I recommend vitamin K2. It has some effect on the brain, but more importantly, it helps to counteract the only side effect of vitamin D3 that we know of, which is it raises calcium levels. So I usually recommend a vitamin D3 K2 supplement, because what K2 does is it takes the calcium out of the blood and pushes it into the bones and the teeth where it is needed. Many people have a lot of calcium deposits. By the way, please do not take calcium supplements unless it is expressly prescribed and by your doctor. And it's usually those who are working out really, really hard and are using a lot of calcium for their muscle contraction. Those are the ones that may have calcium deficiency. But most people simply don't have that kind of problem. Anyway, so the 3 are, so the 4 vitamins I've told you, the 3 minerals are zinc, magnesium, and potassium. These are all extremely important. I would say many people still need some kind of coaching and guidance. So I've become known as sort of the brain health coach. So you can reach out. I mean, I've started creating these cohorts. I think I'm going to start on Thursday, where we actually have a cohort where we give consultations. And Dr. O, that's your sign to say we should end, Abby. Because I'm getting the thumbs up.
No, my sign that you're the brain coach, giving you thumbs up.
Okay. All right, thank you. I wasn't sure what to make of that sign. So most people simply cannot figure this out by themselves. They're too busy. They don't have access to the tools and resources that it took me 20 years to learn these things. So some people may just need some help. But what we do is that we provide a free 15-minute consultation. Even if you never engage me, we can still kind of point you in a few directions within that 15 minutes. But it's only going to be 15 minutes. I always have to come to a hard stop. If we feel that this conversation will need more, I would say so, and then you have to pay for a full consultation. But I will give you my 15 minutes for sure, and I'll give you a link for that to my Calendly as well. So let's wrap this up. Is it possible to reverse cognitive decline? And the answer is duh. Some are harder, some are more difficult, but in my experience, there's no such thing as irreversible. Like I said, it may require a lot more resources, but with the right guidance and the right supports, there are a lot of things that should not progress to the conditions that we see in many of these memory care centers that we are around the country. And you're lucky. You guys are in a country where you have all these social supports. Again, in Nigeria, if you don't if you don't have your family and your family doesn't have money, you are on your own. So your brain is in your hands. I want to really encourage you to take it seriously and really learn how to take control of your brain health. With that, I'm going to end this and say thank you very much for listening.
Thank you. Well, I took notes.
Yeah.
Okay, if you please put the slides down, it's going to
Okay.
help me a
Okay.
lot. And if you put your information in the chat box
Okay.
so that, I don't, I have less people contacting me for it. So if you have questions, you can raise your hand and ask yourself or put it in the chat box. There is a question in the chat box that I'm going to start with. I have questions of my own. Dr. Duyebo says, how did the arrival of COVID cause several categories of cognitive declines as after effects of the disease? What's your opinion, if allowed, on the effectiveness of the use of Privigen to treat cognitive decline?
Okay, so those two questions. Prevagen, let me start with that one. I honestly, I see the advertisements, so it must be working for some people. My experience, I've used it for myself. I usually use myself and other people as guinea pigs. Sometimes my parents, but don't tell them. I just haven't seen that any significant improvements. I just haven't. So I just can't tell you if it actually works or not. For some people, I guess it does, but and everybody I've spoken to has basically said the same thing. How has COVID affected things? I would say significantly, both directly and indirectly. As I mentioned, the infections have increased the risk of the infections, especially those who have had loss of smell, that the virus has affected their olfactory or the nose, the smell region of the brain. Those have a significantly higher risk of developing dementia. Even I know this is controversial, but even the jab, I'll not use the V word, but the jab itself, some people have reacted adversely to it and has resulted in some degree of cognitive decline, and it's in some cases significant neuronal damage in some cases. Then indirectly, because of the very severe stance that some state governments took in isolating people that did not need to be isolated, in children too, that the masking and just the very, very onerous lengths they went to. That calls isolation. Isolation is one of the 12 I's that I talk about. Dementia's dirty dozen. If in some cases can actually lead to dementia. So both the direct effects and indirect effects for sure.
Did you say something about olfactory?
Yes.
For sure.
So the olfactory center in the brain is one of those very important parts. It's very close to the memory center, which is the hippocampus. And if it is affected, but like the infection in the brain, and like COVID-19, some people had the loss of smell. So if the smell part of the brain was damaged, it could lead to
Dementia,
dementia. Yes,
eventually.
So
if somebody had COVID then and had loss of smell, but they got it back, it means that there was no permanent damage.
You cannot tell, but it's a good sign if they got it back.
If they don't get it back, then what do you do?
So there are now certain organizations or businesses where they help retrain. They use different fragrances to help to retrain the olfactory area, and they've shown that it actually has helped restore memory and cognitive health. But yeah, so they're doing something about it.
Nice. So that was one of my questions, and That's right. So another question in the chat box is, did you say not to take calcium? What
Yes.
about for women that are of menopausal age for bone health?
Yeah, that's not what you want to be taking for bone health. People assume, and this is a very wrong, same thing with milk. They assume that because they are ingesting a calcium supplement, that it is going to the bones. That is not necessarily true. They're still, once it has been absorbed, it's in the bloodstream, it still needs to be directed to go into the bones and teeth. If it is not directed by certain nutrients, it will not happen. So if you are low, for instance, in vitamin K2, that calcium is just going to stay in the blood. And having excess calcium in the blood is a problem on its own. Many doctors, unfortunately, don't know this. They see your calcium levels are low, and therefore they want to load you up with calcium. That calcium that they load you up with is not necessarily going into the bones. And so you can still have very fragile or brittle bones, even though you're taking calcium. What is needed are the nutrients that will direct and push the calcium into the bones. Nutrients like K2 and a certain mineral called boron, B-O-R-O-N. As a matter of fact, they're now studying these as treatments for things like osteoporosis and osteopenia. In places like Japan and South Korea, the way they treat osteoporosis is by using high doses of vitamin K2.
So, to buttress that, Dr. Ajibade said earlier that do not take calcium unless your doctor prescribes it. Don't go buying calcium. I know that even in hospitals, nephrologists have, sometimes this tags on to help us, primary care physicians, not to prescribe calcium, just for the fun of it, that you have to be intentional. There has to be need for it, and it has to be prescribed appropriately. They will wear these tags, warning against prescribing calcium. So let your doctor take care of you and prescribe it to you if you need it. The doctors know when you need it, but don't take things into your hands to do it by yourself. It says, how would you improve patients with CVA? CVA, sorry. How would you improve patients with CVA and traumatic brain injury, or patients with anoxic encephalopathy following CPR?
What's CPR?
Cardiopulmonary resuscitation. Yeah. I don't know. Can you please unmute and ask your question in a clearer format?
Yeah,
And
this is
please
Dr.
bear in
Bazi.
mind, just a minute, bear in mind that we have people on the platform that are not doctors also. So we
Hello,
have to
can you
carry
hear
that
me?
on. Yes, we can
Yeah.
hear you. Can you hear me?
Yeah, I can hear you. This is Dr. Bazi.
Dr. Bazi, how are you? Oh, yeah,
How
speak
are you?
English, oh, my darling brother.
Okay. Okay. As a pulmonologist, I see quite a few patients that have CVA, that's the cerebrovascular accident. They've had a stroke, and they're on the ventilator. And I also see patients post CPR. They have anoxic brain injury, that is, they have a cardiopulmonary arrest. And so I was wondering, what can we do to improve these patients following these cardiovascular or catastrophic events?
So I'm assuming that these are patients that are out of the hospital, they've been stabilized, they've been sent home.
Some of them are not, some of them are still in the hospital.
Well,
some of them have been sent home.
Yeah. If they're in the hospital, there's nothing that can be done.
Some of them that have been sent home, weaned off from the ventilator and sent home, but they still have severe cognitive impairment.
Yeah. I mean, there's a lot that can be done. I mean, the only restraints are that there'll be a tight control on what they can take and what they cannot take. So they need someone who can override, quote unquote, the doctor's orders and say, we want this person to work with them. But it comes down to basically we're nursing, nourishing that brain back to health. I don't know if you're asking me for specifics, which I cannot give or will not give. But I can tell you for a fact that I've had patients who had this, what you've just described, that we nurse back to health. But it's going to take a lot of different combinations of nutrients and working with them one-on-one.
So the ones you've worked with, did they improve?
Yeah.
Okay, well, I'll get your information on maybe at some point in time,
Okay.
I'll have some discussion with you.
Okay.
This information is posted on the platform, but
Oh,
Dr.
okay.
Bazzi, I'm going to
Yeah,
reach out to
I
you.
put a Calendly link, so you can have. It's actually a 15-minute link, so if you can schedule a time, and then of course I put the link for the download of the Dementia Dirty Dozen. Folks, I just want to say this, that what Dr. O is doing is fantastic. These are great talks and all that, but you've got to go back and do some reading by yourself. This 1 hour, 2 hours is not enough, and I feel that many people simply don't do that other reading, and you're going to lose out significantly if you don't have some kind of follow-up to find out how this can be applied in your own case or your loved one's case. So I really want to encourage you to try and do some more reading and do some more investigation, not just rely on this once a week talks.
Thank you for that encouragement. We all need to do that, to research more on this and get better health. But Dr. Bassi, I'll reach out to you. I'll connect Dr. Ajibade on another platform one-on-one, because we always have to give that physician courtesy. And Dr.
Thank
Bassi
you.
is my bro.
Thank
So
you.
I'll connect with you. I'll connect you guys. Dr. Izugu, kindly unmute. Fantastic.
People, Bazzi, good to hear your voice, man.
Thank you.
So,
Nice to hear your voice. Thank you.
So we have a pulmonologist on the
Congratulations
platform.
on your clinic and your delivery. Congratulations.
No, we thank God for that. That's a miracle. Only
Yeah,
God does things
that's a
like that.
big miracle. My God, quadruplets in Nigeria. I mean, that's something. That's
Really?
something.
I missed
Yeah.
that
Yes.
one. They delivered
Yeah.
quadruplets in your clinic
Yes, I think
at one of the
EPT
HTPTCs?
Yep.
I'm
And
on the
all is
board. How
well.
come I didn't know?
Yeah, that was on Thursday.
Wow.
Please, I've been too busy. Oh, God help me.
Congratulations, sir.
Congratulations to us.
We're thanking God. He's doing that.
Wow.
Yeah,
That's so
it was
cool.
awesome. Yes. Yeah, David, thanks again for your presentation. I wanted to ask more to do with basically vascular dementia and hypertension, in terms of the role of that. And, for us in hypertension, we think about end organ dysfunction. And to us, brain is one of the end organs.
Yes.
So there are certain medicines we try to use in managing blood pressure to make sure the end organs are protected. If you can make some comments on, hypertension or other in terms of vascular dementia, and the role of certain medications in that type of situation, it will be good. And then also regarding the calcium, question, quite often sometimes we even do ionized calcium to really make a determination of whether the patients need the calcium to be given. If, any comments on in that perspective. Thank you.
I'm sorry, is it the last part again, sir? Any comment on what?
And for ionized calcium, checking that ionized calcium even before trying to, not just the serum calcium level alone as a determinant of, giving calcium.
Oh, okay, sir. I got to admit, sir, I don't. I am outside the hospital setting, so I don't check with ionized calcium or calcium levels. I just like to just stay away from calcium completely, and only recommend it. I recommend that people find out from their doctor before they go on any calcium supplement. Now, having said that, calcium channel blockers appear to be the most effective drug, and you can correct me if I'm wrong, sir, for the Black community when you're treating hypertension, calcium channel blockers, and maybe the water pills, the diuretics. Is that still the case, sir?
It is
Well,
from
those
recent
they
research.
they can lower the blood pressure. They are not the key end organ protective medication. So even though we use them a lot to lower blood pressure, it becomes important that we block the RAS system to protect the end organ.
Mm-hmm.
So using them on their own like that, calcium blockers and diuretics or hydrochlorothiazide, you actually, in many instances, you will rev up the RAS system, which is responsible for end organ dysfunction. So it becomes important that those RAS systems are protected, that we give such medications in addition to those ones that lower blood pressure, like you mentioned, the calcium blockers and diuretics.
Can you explain to me just briefly,
combination becomes important.
Sir, can you explain to me how the RAS system, or how is the ARBs, I think we've discussed this before, but is the ARBs that protects the end organs? How exactly do they do that?
They do them through the receptors. That is beyond our discussion here, which they do them through the receptors. Because,
okay.
Yeah.
Okay. I mean, I hesitate to say this, but I know I've said this before. I mean, I developed during COVID-19. I became during the pandemic, I became very overweight. I mean, I was 215 pounds. I had no idea that I gained that much weight because we're not exercising. So I developed high blood pressure. I mean, it was only in church. There was one church in Houston where they were just doing free testing, and I was traveling through Houston. So I decided to attend the church, and they tested our blood sugar, tested blood pressure. My blood sugar was perfect, but my blood pressure was high. I think it was 150 over 110. I was like, yikes, what happened here? Anyway, I mean, I'm 5'6". I weigh 215 pounds. I was heavier than Michael Jordan. Anyway, so I went on calcium channel blockers. Amlodipine is one of the most popular ones. And I used it for about 6 months to a year. Yeah, and it was controlling my blood pressure, but it was also causing other symptoms as well. So as a nutrient kind of person, a nutrient biased person, I decided to look to see what are my other options nutritionally. Eventually, I found one. Again, I'm a doctor, so please do not check with your doctor before you do this, folks. I found one that had potassium, because I studied about the effect of potassium on blood pressure, on blood pressure. So I found a potassium magnesium combo that I've been using now for the past 3 years. It has kept my blood pressure between 120 over 170, 120 over 80. So it has helped with that now. So I'm curious as to, okay, what do I also need to do to ensure that my end organs are safe as well? So, I mean, I'm doing other things as well, but what you said is of concern to me, because if what you're saying is that it is not enough just to use medications to control blood pressure. You also have to take the other step to protect the end organs, right?
Yeah, again, blood pressure is a systemic problem. It's a pressure problem and a physiologic problem.
Okay.
You can control blood pressure and say the organs will fail.
Yes.
Because you're just dealing with the number, But the issue is that you have to protect the end organs in the setting of managing blood pressure. Because you can give somebody a blood pressure medicine and still they get upset and pressure shoots up,
Yeah.
in between.
Yeah.
And those organs still have those effects. So you combine, you make a combination of medication that protect the organs under those type of surgeries and also help to really maintain those organs. And it's important. Yeah.
Got it.
And if you look at the RAS system in dementia too, especially vascular dementia, you would say, they should be beneficial. And the reason why I also bring it up is that many of us suffer from blood pressure.
Yes.
And not only just the issue of just controlling the number, it's important that it is managed properly and not the idea that you only want one medicine to control your blood pressure. That's not the way to manage blood pressure. It has to be a combination that must include end organ protection in addition to bringing the number down.
I think that's very important. Thank you, sir.
Sure.
One quick comment. Do you have this is Dr. Bazi again regarding riboflavin. There is a recent article that is out that shows that taking riboflavin decreases dementia by at least about 40%, with significant improvement in patients with Alzheimer's disease. Do you have any knowledge of this or
I
comments?
saw that study. So riboflavin is vitamin B2,
Right.
if I'm correct, if I don't, if I remember correctly. So it helps with basically the basic function it does is that it helps with energy production by the cells in the brain. So anything that can help with energy production, again, it keeps on going back to that. To me, that's the cocoa of the matter, as I mentioned last time. Anything that can help the brain produce more energy can conceivably pull it out of dementia. And so you'll just be left with focal deficits. But if we're talking about what really Alzheimer's disease is the brain saying enough, and it is shutting itself down. It is pulling back all those like branches in spring or branches in autumn or fall. They're pulling back the leaves and all that. They're just shrinking. That's really what's happening in dementia. And it's happening because the energy levels are subpar, or they're not enough. I mean, for lack of a better way to term it. So anything that can help the brain generate more energy, like riboflavin, like vitamin B12, even vitamin B1, can conceivably help with dementia. But it has to be used the right doses at the right time and all that. So
what about patients that giving vitamin B12 to patients that already have high levels? What do you think? Because a lot of my patients, when I check their vitamin B12 levels, their B12 levels is already high.
Okay.
Should we be giving those patients extra supplements? Because a lot of patients are already taking it in some of these weight loss centers, vitamin B12, despite the fact that they have normal levels or higher levels.
So, I mean, I have two things to say that. Obviously, if it's normal, then you don't want to be pushing the limit because that can have its own problem. But also, from my experience too, when people say normal, it may not be optimal. And so some argue, some doctors or healthcare, shall we call them longevity doctors or longevity coaches, will say we want to make it optimal, so they will give you more than what is necessarily what would be considered normal. A good example is vitamin D. I mean, I think it's absolutely ridiculous. I think it's complete nonsense, with all due respect. When the recommendation is shall we say, I think 800 international units a day. That's the recommendation. That's ridiculous. And then when they test your blood, the range is 30 to 100. Many doctors, if they see 27, they will say you're fine. Now, the doctors who know what they're doing say that. I know a cardiovascular surgeon who will not accept anything less than 100 because he has seen how it protects the brain and protects the cardiovascular system. So, I recommend people should be as close to 100 as possible. Like I said, most doctors will look at your blood, your readings, and they'll see 27, 28. It's close to 30. This patient is fine. Not realizing that it's the higher levels that are protective of the brain. If it's just 30, okay, maybe you're not going to have osteoporosis. That's going to protect your bone. And if it's 40, maybe it's going to help your immune system. It's not going to, that the levels that are required to protect your brain are higher, 80s, 70s, 80s, 90s. So, and people are always afraid of this, but I mean, it's still within the normal range. So just to answer your question, sir, Dr. Ed, I have mixed feelings about it. That person may have normal vitamin B12 levels. It may not be optimal for the person, and that's a different discussion. Or it may be normal and it's okay for the person. So I have, and I would never only use one supplement anyway. So I always combine a lot of things. So those are my thoughts about that.
Thank you.
Yes, sir.
I want to comment on the vitamin D. Less than 30 is suboptimal. 30 to 100 is normal. So when a doctor sees the level that is 27, 28 and says it's normal, it's not. It's not in the normal range yet. So the way we treat though in the US, we actually stick with those normals. It has to be over 30. And even over 30, we tell the patient to continue taking it. And usually, you know, a lot of doctors prescribe 50,000 international units once weekly. Some doctors prescribe 5,000 international units daily. Most doctors actually do the 5,000 international units daily. And, you know, some patients remember the once weekly, some don't. So sometimes it's better to take it daily. And, you know, you have to know your patient. So it's different. Anyways, thank you, both of you, for that. And riboflavin, thank you, because you told us earlier to take B2. Riboflavin, as research just showed, decreases dementia by 42%. Is one of the supplements that Dr. Ajibade had encouraged us to add on if we weren't taken. Olutunde, I don't know if it's, you know, it's difficult to say if this is a male or female from the name. I don't understand this question. It says, or trying to collect things, may find it difficult to remember something of recent. Can we? Can we call it cognitive impairment for such a middle-aged lady? It is not a complete statement. I think you started writing and then probably lost some of it. Kindly unmute to ask your question. I've been pushing the ask you to unmute button. If you please unmute and ask the question, that would be fantastic. Thank you.
Hello, ma'am.
Hello, good evening.
I'm sorry I didn't start with you. I just want
Oh,
to know
all the way from Nigeria, Dr. Olutunde. Welcome
Well done.
in the middle
Thank
of
you,
the
ma'am.
night. Thank you for joining. Yeah, go ahead,
Yes, ma'am.
please. Yeah.
I just want to know whether we can call it a cognitive impairment for a lady, a middle-aged lady who is not able to recollect or remember things of recent. I just want to know, is it not too early, or can we call it a cognitive impairment? That's my question. Thank you, ma'am.
Thank you so much.
Yes, ma'am. Yes, ma'am.
Dr. Ajibade.
Yes, ma'am. It's everybody forgets something, and everybody is not. So I'm not sure how best to understand. I mean, if it's something that everybody around you is complaining about, that you're not remembering and all that, and that it's actually interfering with your, when it becomes significant is if it's affecting with your, it is interfering with your daily living. That's when people will now think that there's something going on. Let's say you forget your husband's name or your spouse's name 3 or 4 times a day, or you forgot that or you forgot. I mean, there's some things that's clearly, once it begins to happen over and over and over again, or you ask the same question over and over again after the person has answered, the other person has answered. Those are some of the issues that can raise red flags. But if it's just a little decline in memory, that's, I mean, that happens to the best of us. So I maybe if you're more specific, maybe we'll be able to. But if you're just concerned about memory loss, that happens to the best of us. Like I said, these are things that can be addressed, and I've done it over and over and over again with basically with nutrients, because your brain will function better if it's given the right nutrients. So I don't know. You're just asking just for your knowledge, right?
Yes, sir. Yes, sir.
Okay.
Thank you.
Thank you so much.
Yes.
You're
yes,
on
sir.
call, right? You're on call in Niger?
No, it's today that will be on call. I'm
Oh
not
my
on
God.
call.
Then please get some rest. So thank you. Thank you for joining in.
Yes, ma'am.
So there's another question here. It says, awesome presentation. I mostly appreciate the teaching on estrogen level test in relation to brain health. Thank you. It's a comment. And Dr. Alu says, thanks a lot, Dr. David Ajibade, for this life-saving presentation. Quite instructive. But there's another question. What is the recommended dosage of B2 riboflavin?
That's is not. I haven't used it specifically, but I'm sure you can find it somewhere. I've not used it as a treatment. This study just came out recently, so I'm going to be looking into it some more, and I can get it. But you can ask ChatGPT.
But you encouraged us to take it, B1, B2, and B12.
Yeah, I encourage you to take
before.
I encourage you to take a vitamin B complex.
Complex, you did.
Yes, yes, that is in the right proportions and the right show. That's as a basic bottom line. Oh, by the way, I think lithium too. For those of you who want to go in deep, there's also lithium orotate. That's it's like a mineral. It too is emerging as one of those minerals and nutrients that I don't know if you've heard about it, Dr. O, but lithium orotate. Lithium, yes, lithium orotate. It was known as a psychiatric drug.
Yes.
Yeah, so it's still being used as a psychiatric drug. But
we use it to treat bipolar disorder.
Yes, ma'am. So it's in much higher doses, but they're finding out in smaller doses, like 5 milligrams. So bipolar treatment will be about 600 milligrams. But in small micro doses, as they call it, they found lithium over a period of time can help to be protective against dementia. Something to go study and find out.
Yes, I'll look this up. That's interesting. Wow. Thank you. You know, knowledge is power, and we keep learning every day. This is exciting. This has been amazing. Dr. Felipe, I see you on, looking intently. Do you have any comments or questions?
No, I want to thank Dr. David for the presentation that he gave us again here. Mental health is, I believe, unfortunately, the disease of the future, which is already present now. And with this presentation, it was clear for us that the current strategies that are used based on medication have limited potential or give limited help. And as a medical doctor who believes in the use of supplements and nutraceuticals, that's completely revolutionary, because I believe that's the way the future guides us to. So I want to thank and applaud him for his oversight on a very, very sensitive health matter. Thank you.
Thank you very much. I appreciate it.
Thank you.
Yeah.
Thank you. So, do we have any other questions, comments? If there are none, I'm going to ask Dr. Ajibade to please give us his take-home message. But before I, yield the floor again to him, there are lots of things going on around. Please let us be careful with hand washing, being careful in crowded areas. Mask is still in fashion. We need to be safe. There are lots of things going on around, and it is important that we do the needful to protect ourselves. So, Dr. Ajibade, I just remembered, tell us more about hair dye, those things that you said we women put on our bodies that could be toxic. Because, we're getting white hair and we want to make it, decorative, dye it to something and stuff like that. People have talked about hair dyes and said we should avoid hair dyes that have ammonium in them. Ammonium-free hair dyes, they say, is safe. What's your comment?
It's never just one thing, Dr. O. It's a compilation of different things and accumulation over the years. So I want to be cautious about it. I think the key is awareness, letting people be more selective, women especially be more selective about what is natural and what, obviously aluminum, we've been hearing about this even as a deodorant, aluminum containing deodorants, that everybody should be aware of it, because once you spray it under your armpits, the aluminum it's absorbed into the bloodstream and it can accumulate over time. These are heavy metals that can conceivably affect the brain over time. The thing, another thing I've seen is the braiding, the addition of hair braids. Many times they use a lot of heat to meld or mesh the braids to the normal hair, and that may burn off the chemicals, and the chemicals can get absorbed somehow into the bloodstream. I've read somewhere that could be an issue over time. So, I mean, these are just things that people just need to be more aware of, with women, Black women in particular, because of the pressures, especially those who work in business, in the business world, or who are into finance. I mean, in the corporate environment, there's a lot of pressure to straighten your hair. And with Black women, sometimes, especially those who have very thick curly hair, they have to apply a lot of these hair straightening chemicals to straighten their hair so they can look like the other white women. I mean, it's a real pressure, and they have done this over years. And looking at the research, they show that in itself, because of the chemicals that they've applied to their scalp over time, has increased the level of toxins in the bloodstream, and which again can eventually get into the brain. So it's really a question of cumulative. So it's not to scare people, but just to let you be aware that a little here, a little there over time can create a bit of a problem. So you want to be more shall we say, perspective? No, but what's the right word now? Conscious. Thank you. About what is out there and what you can use. Now, having said that, again, because I approach things from what can we do, what it's not just enough just to avoid certain things, because how much can you really, let's just be frank about it, how much can you really avoid? You can only avoid what you know about, but there are things that you can do to strengthen your body and your brain over time. And part of what strengthening your body entails, you can also there are certain nutraceuticals that we start using with kids with autism who had a lot of toxins and heavy metals in their system. We found ways to help them remove these toxins and heavy metals from their bodies. If I was advising my sisters and my mothers, some of you, which many of you are, I would say, in addition to avoiding these chemicals, I would say you need to take some of these toxin removing substances that can help over time to reduce the burden of chemicals in your body.
Thank you so much. Thank you. I'm glad I remembered to ask that. Madam VP, Madam CEO, kindly unmute. Welcome.
Hi, Doctor. Well,
Hello.
I can't find my camera. I have no idea what's going on. It's Dr. Ajibade's.
Put the camera on.
Okay,
yes,
here I
here
am.
you go.
All right, Dr. Ajibade, great job. I want to my question is, the 1-a-day vitamins. They now have one that it says for over 65-year-olds, and it contains this riboflavin or whatever that word is. Is the content there, even all the B's, the 1s, the 6, is that insufficient or is it inadequate for the protection that we're talking about? Do we now need to also now supplement or complement this with individual dosage of riboflavin, vitamin B, C, and all of those?
Yeah, my experience with these multivitamins is they just have the token amounts. They just have, it's just to say, Ajifikini is better. Just so
Can you translate? I don't understand that language.
It's just to say that on paper we have fulfilled all righteousness.
Okay.
It's, in my experience, it is rarely the amounts that your body actually needs. So okay. I would recommend a separate B vitamin complex.
Okay. All right.
Actually, there's a research that's discouraged taking multivitamins.
Really?
Yes. Came out, it must have been a year or two ago, actually. It's been a while. And so we encourage not to recommend multivitamins to our patients unless in certain cases where people can eat and other things like that.
So you take the individual vitamins instead of the multivitamin?
Yes.
Oh my God, that's like 20 of them.
You'll be able to take it in the dose that is needed or recommended.
Okay.
And that's what Dr. Ajibade was trying to explain, because I know what he does, to know the right combo, what is needed.
Okay.
Yeah, I mean, Dr. Ono knows this, but I mean, I just haven't found a supplement out there that has like when I talk about the non-negotiables, these 7 things. I created a formulation. By the way, I've created a formulation for sickle cell disease that has been working amazingly well. So all this fear.
Whoa, great job. Congratulations.
Thank you, Ma. Thank you, Ma. So we've been giving it all over the country, and we had somebody who was able to back, so was able to finance it, and we give them to from 2-year-old all the way to 60-year-olds. Amazing results.
Wow.
Because they had the right nutrients in the right amounts.
Understood.
So and obviously I know how difficult it is for people to take this vitamin B, this vitamin C, this, and then I mean my table is full of, like, I have at least 10 supplements. So for me too, I would love to have something that just has everything in one. It can be a tablet, because that tablet will be this big, right? So we're trying to create a powder. I mean, the formulation and everything is already ready. It's just waiting for the right Dr. O, what do we call it now?
The right sponsor.
Right sponsor, that's right. The right financier.
Yeah.
To get it done. But it's already it's just waiting. And I think it will help a lot of people.
So what is the price tag for the sponsorship?
That is not conversation for this forum.
Okay. Hey, we have to put our money where our mouth is. If we have a life-saving thing that is coming up, I know this is not a platform to endorse anything, but we just need to have an idea.
It's not a platform. It's not a place.
Understood. Okay, so Dr. Ajibade, call me.
Okay.
So, Dr. Gulaye, kindly unmute. Oh my gosh, I see that suya pack.
Hello, everyone. I put it in the comment section, but just in case people may not see it, that's why I want to come up and talk about it.
I saw the henna. Please.
Yeah. When I heard talk of the chemicals in the hair dye, I just wanted to encourage us to go natural with our own plants. Henna is really, really good. It's not just for lali, to decorate the hands and feet like they do in Arabia or in northern Nigeria and Kwara and so on. It's also to dye your hair, and I've been using it for years now. And let me just show you. I'm out in the sun, so maybe you can see the tint. This is my hair. And all I do is I imported the henna from Nigeria, the actual leaf, dried and ground, right? And I mix it with water, put half a lemon, mix it with shea butter, and then apply it in my hair. And steam it or go about my business, put on a shower cap for normally do it on a Saturday when I'm not going anywhere, or Sunday, and then go about my business for about half the day. And when I wash it off, my hair is this beautiful color. So I think we should cultivate that so that we don't get all these nonsense chemicals into brain cells. That's just what I want to say.
Where
Where are
does
you?
the
Are you
henna
in
come from?
California?
Yes.
Yes, I'm in California. Oh, you saw all
Okay.
the sunlight, have you? Hey, Cali, baby.
That's a get. Every good thing is from California. Okay,
I don't know
everybody.
about that too.
What in jealous?
Is
Yeah, Suya is from California. What are you looking for?
Maryland is where God resides, but
That's
this
right.
Obalende Suya is from
You guys just have
California.
the power because you have DC right next to you, but the
I
real
just-
power is here. The individual power is here.
Definitely, ma.
So yes, henna is the way to go if you don't, because for years, I don't know, Madam VP, you must have seen me. There was a time that I decided, okay, I'm not going to dye my hair. I'm just going to leave as is. And people were mistaking me for an old woman. I'm like, hey, I'm not even 80 yet, right? My mother is still doing CC. Why would I now start being addressed as an old woman? So I decided to, because I've been growing gray since I was 25.
Oh,
Wow.
wow.
Yeah, so I decided to now start dyeing it, and I haven't regretted it once. It's a
So
beautiful
is
color.
this henna? Is it edible?
Uh, I don't know about that. It's not every leaf out there that you eat, right?
Yeah, I'm just asking.
Where
So
do you
yeah.
get it? Where can you get henna?
Oh, you can buy it on Amazon.
Okay.
Yeah, I ship it in from Nigeria, so I buy it in bulk from Nigeria because I know that I use it a lot, and I use it like once every 2 months.
Okay.
Yeah.
Thank you.
You're welcome.
Okay. So, okay, I'll chat with you right after this.
So
But
I
we
just
haven't-
also another suggestion in terms of the what to use instead of the regular ones. For deodorant, I find at Mom's they have the natural ones, because I know when we were in med school and there was someone did a research on this particular issue about using deodorant and breast cancer. And the result was amazing. It was unbelievable. So a lot of us tried to use something else, mix this, mix that, and which didn't really work. But I found some deodorants that are natural at Mom's.
They don't have aluminum, right?
Yes, that doesn't have aluminum.
Okay. Because they have them also at, some other stores. Giant, I think, has,
Okay.
because you see it, they would actually write there that no aluminum.
Okay.
It's very important to avoid that. But thank you. I wrote it down. I'm taking notes, so Moms, I'm gonna check them
The
out.
organic store.
Yes. Thank you.
Sure.
There's
Yeah,
a
Doctor.
question.
I was gonna say, sorry. This
Go
is
ahead.
Akinshola. So I was going
Yeah.
to say that the Adventist shop, the bookstore,
Yeah.
they also have such deodorants.
That's good too.
Hey. Adventist
Advantage.
shop.
Yes, yes. They sell
Yes, they do.
organic stuff too.
Mm-hmm.
There's one right here on Sherry Hill Road.
Really?
Yes. Beside Target.
Okay. Fantastic. Thank you. It's
And
important that we are careful and not put this, heavy metals in our
Dr.
system.
O,
Yes. Go ahead.
good evening. Well done.
Good evening.
I've been
Okay.
using lavender oil,
Mhm.
lavender oil,
Uh-huh.
and I've been fine with it as my roll-on. Just the oil. That's,
Lavender oil.
yeah. I put it in a
Good idea.
device.
That's a good idea.
Yeah, you can spray it or you can put it in a device and make it easy for you to apply.
I have a question, Doctor.
Go ahead.
What is pantothenic acid? Dr. Ajibade?
That's
I'm looking.
That's vitamin B5. That's also let me see. What B5? I know it has to do with it's what I can't keep up with all these different names, but it does a lot of things. Well, that's what in fact the name pan. So you have pandemic, pantothenic. So pan, it covers a lot of different things, including brain health, including energy, including cells and all that. But I've forgotten what it does specifically.
Okay.
But it's one of the B vitamins. It's one of the very important B vitamins.
I never even heard about B5 before.
Yeah, there are also about 8 to 10 B vitamins. So there's B1, B2, B3. Which I don't know, for whatever reason we skip B4. Then there's B5, B6. There's B7, which I guess is biotin. Then there's no B8. There's B9, which is folate. Then there's no B10. There's no B11, but there's B12.
Mm-hmm.
So, and then some people talk about B17, but I don't know what that is. It's hard. It's hard to keep up with all these things.
Yes, it helps your body to convert food into energy.
Yeah.
And synthesizes hormones and metabolize fats.
Which one?
B5, pantothenic acid.
I mean, that can be said of really almost
all of them, I thought.
Dr. David.
Yes, ma'am.
I'm not sure if you're aware that vitamin B complexes make people to eat and they gain weight.
Yeah, that's true.
You crave for food so much. And just like Dr. O said earlier, for certain patients, you want them to gain weight or there's some specific reasons for asking them to take vitamins. And B complex. What I'm thinking is, would there be any natural product where we can get all these B vitamins from? Something like moringa, maybe? Please.
I do not know if moringa would have everything, all the B vitamins. I can tell you one thing for sure that has a significant amount of B vitamins, but some people don't like don't like hearing it, and that is the beef steak will give you a significant.
Madam BP will love that.
You're speaking my language.
Yeah, meat lover too, ma.
Yeah.
Finger licking, that's it. In moderation, without the fat, I get it.
No. That's where people are wrong. You need the fat in the beef.
Bring it on, man. Bring it.
What about having goat meat instead of beef?
There's no reason to avoid beef. There's no reason. All this fear mongering has pushed, especially women, in the wrong direction. That said, goat meat is I love goat meat as well, but the most nutritious, dense food on the planet is beef.
You are a good doctor.
Okay, is Daddy Ezogu on the phone? Because that's the heart doctor. Daddy Ezogu, what do you say?
Dr. Ezogu, where are you? Where is he? Even when he's going into the car, he's still on. Well, I don't see him. Okay. So when he comes back on, we'll ask about the beef, the heart. But vitamin B is water soluble. So I'm trying to see how it could cause weight gain. All the B complex, all the vitamin Bs are water soluble. So they really should not cause weight gain. But they will
Makes you eat to crave.
Sorry?
eat. You eat more. You're craving.
Yeah, it increases your appetite for food.
God bless you.
Have you tried it? Is
Yeah.
that what? Okay. If your body is deficient of vitamin B and you're taking it, yes, it will restore what you lose and it would increase your appetite.
Yeah, those are the
Otherwise,
people that
it
need
shouldn't.
it.
Yes, otherwise it shouldn't. So, for whatever it's worth. Okay.
It makes me hungry. So I try not to take it in the morning, but then
you're probably deficient.
In the B?
Yes.
With all the beef that I eat, beef, no.
But if you take it along with the beef, if you take it along with your beef, does it still make you hungry?
No, the beef fills the appetite.
Okay.
Okay.
I mean, if my thinking, yes, I mean, we've been told this from childhood that, in fact, that's why people take B complexes to help us eat, especially children, to eat more. But if you take it at the same time you're eating, when you normally eat, I'm thinking that it should not make you hungry afterwards.
That's correct.
Okay.
So, Nkechi, you can ask your question. Thank you.
Thanks,
So
Doctor.
thank you, ma.
Good
Good evening,
evening.
everyone.
Good evening.
The medicine we are all talking about, the
we've not talked about medicine at all.
Oh, sorry, the vitamins that you're talking about. I know that B12 keeps you awake and gives you energy, a lot of energy. If you take it like in the morning, instead of you taking coffee, it makes you stay awake. For me and for so many people that I know. And all these drinks that they sell, if they put vitamin B12, it gives you energy. But the B5 makes me eat, or B2 makes me complex. B complex makes me eat a lot, even when I eat it with food. So I don't know. I agree with the other people that are saying that it makes you eat a lot. But that's for me. I don't know for any other person.
Well, for me, I would say basically we know that treatment or healthcare is not one size fits all. It's individualized somehow. So that's where testing and talking to your primary doctor comes in, because many of us, we have different results for different things based on what we are lacking or what we have more of.
You're right. Right on the money. And one person's response or reaction to a supplement, a nutrient, even medications, even food is different from another. Even the food we eat. So one has to try things and then see how you respond to it personally. Thank you so much, everyone, for your input for this robust conversation. Dr. Ajibade, I'll now finally give it back to you to give us your closing remarks. Thank you.
All right. Thank you again, Dr. O, for having me, and thank you everybody for your contributions and your questions. It's always great to discuss this. But I just want to reemphasize that the conversation shouldn't stop here. Everybody should have what I call a brain protection, or they should be on a brain protection program. Probably maybe sometime in the future, Dr. O, I'll talk about why focusing on brain health is probably the ultimate, because it helps you if you focus on your brain, it means that you're focusing on your cardiovascular system, it means you're focusing on your digestive system and all the other things. But everybody should have something that they are doing that works for them on a daily basis that is protecting and hopefully strengthening their brains. We cannot leave this to chance anymore. It is absolutely vital that you should have your own specific brain protection program that you are on and that you are executing. And as Africans, unfortunately, we don't take it seriously enough. So please, I want to implore you to consider and take it seriously, being on a brain protection program. So if I ask you on the streets, what are you doing for your brain? You can tell me this, and this, at least 3 things. So that's what I want to leave you with.
Thank you so much. That is so true and it's so key. And I like the topic you just talked about, why focusing on your brain is the ultimate. Because if you don't take care of the brain health, everything else will fall apart.
Yeah, Dr. O, just
Yes,
for, I mean, Africans care about their brains. We just grew up with the myth that, oh, it's normal part of aging. But now that we know better, we're going to do better, because we know you don't have to age with sickness or disease or any of this crap. But that's the way we were programmed or conditioned, so to speak. So
right. You're right. We were conditioned to a lot of things. Plus, yeah, back home when people are older and they don't remember things and stuff like that, it's old age.
exactly.
Somebody said it today that once you turn 60, you start seeing decline. I disagree because my mother passed at 94 and she
I
was
know.
together with it. Hey, hey,
Mama Rocky.
I'm telling you, still together with it. So we can't say you have decline. We need to take care of ourselves so that we can prevent decline. And we need to re-educate ourselves to not, to not believe the wrong myth, like you said, because I think it is wrong. It's a myth, but it is not the right one.
Correct.
Thank you so much. I think we started June well, Alzheimer's and Brain Awareness Month. But we'll bring other speakers because we don't like to stick on one thing. Dr. Famuyiwa will be coming back next week. So till we see again next week, please stay safe.